Welcome to the CONCIERCARE Health System podcast. The information shared in this podcast is for general informational purposes only and does not constitute medical advice. Listeners should be aware the content is not a substitute for professional medical advice, diagnosis, or treatment. Always consult with a physician or other qualified healthcare provider for medical questions.
Welcome to the Deep Dive. Today we're tackling something huge, something that's woven into the fabric of our lives. Social media. You know, that endless scroll on the bus, the way we keep up with friends far away. It's just everywhere. But what's all this constant digital connection actually doing to our mental well-being? Our mission today is to get past those simple good or bad debates. We want to really unpack the evidence, which is, frankly, pretty complex and sometimes contradictory. The sources we've looked at show the effect isn't the same for everyone. It really hinges on how you use it, who you are, and critically how these platforms are actually built.
Exactly. It's not a straightforward cause and effect thing. Think of it more like a dynamic process. Every time you log on, it's your psychology interacting with your specific usage patterns and, crucially, the platform's design. It's this multifaceted phenomenon, and that's what we're going to explore today.
Okay, let's start with just how common this is. I mean, the numbers are pretty staggering, aren't they? Our sources say up to 95% of young people, like 13 to 17, are on social media. 95%.
It's almost universal in that age group.
And nearly 2/3 use it daily. Get this, about a third say they're online almost constantly.
Almost constantly. And, well, we all know the pandemic just ramped that up for everyone, didn't it?
Definitely did for me.
And what's worrying is that this rise in digital life has happened alongside a really marked decline in youth mental health. We're talking about public health bodies like the U.S. Surgeon General, the CDC. They've declared a national crisis. Alarming increases in depression, anxiety, loneliness, even suicidal thoughts.
So it's really tempting to just point the finger directly at social media, right? That seems to be the common narrative.
It is. It's an easy connection to make.
But the actual research, it paints a much more, well, complicated picture. Often contradictory, even.
Exactly. That initial question, does social media cause depression? It just wasn't the right question. It's too simple.
The inconsistency across studies isn't noise, it's the signal. It tells us the impact isn't uniform.
Precisely.
Yeah.
So researchers are now asking better questions, like, okay, under what conditions? For which people? And through what specific mechanisms does social media use actually influence our well-being? And those are the three big areas we'll dive into. The psychological mechanisms, the user factors, and the platform design itself.
Right. It really feels like this incredibly powerful tool that can cut both ways. A double-edged sword, maybe.
That's a very good way to put it. It has this capacity to both harm and help.
So let's start with the weight of the negative evidence. What does that look like?
Well, there's a pretty consistent finding, even if the effect size is often small to moderate. Higher frequency use, or what researchers call problematic social media use, or PSMU.
Problematic use, like addiction or something close.
Sort of, yeah. Compulsive checking, neglecting other areas of life because of it, that kind of thing. That kind of use is linked more strongly to negative mental health indicators.
Okay, and what about specifics, like depression and anxiety?
Meta-analyses, studies that pool lots of other studies, they do show positive associations. Maybe around R0.12 for depression, R0.10 for anxiety with general use, stronger links, moderate ones for that problematic use.
And there was that longitudinal study too, right? Following kids over time.
Yes, that one found adolescents spending over 3 hours a day on social media had double the risk of poor mental health outcomes. Double.
Wow. 3 hours doesn't even sound like that much anymore for some kids.
It really doesn't, and we even have some evidence pointing towards causation. There was this fascinating study looking at how Facebook rolled out across U.S. colleges, sort of staggered.
Oh, the natural experiment.
Exactly. Its arrival was linked to about a 7% increase in severe depression and a 20% jump in anxiety disorders among students.
And they figured out why.
It seemed to be mostly driven by negative social comparison, seeing everyone else's curated best life.
Right. The compare and despair. We'll come back to that. And it's ironic, isn't it? Platforms designed for connection linked to loneliness.
It is ironic. There's the displacement hypothesis, basically. Time online replaces richer face-to-face time. Or you get that feeling of being alone together, surrounded by people online, but still feeling isolated.
And then their self-esteem and body image. That seems to come up again and again, especially for girls.
A very recurrent finding. Lower self-esteem, poor body image, particularly with highly visual platforms full of filtered, perfected images. It's that highlight reel problem creating constant comparison.
Okay, so that's a pretty concerning picture on the negative side, but you said it's double-edged. What about the positive side?
Absolutely. There's also a really robust body of research showing significant benefits.
Like what?
Enhanced social support and connection is probably the biggest one. Maintaining relationships over distance, reducing loneliness. It's genuinely powerful for that.
Especially for certain groups.
Critically important for marginalized groups. Think racial or ethnic minorities, LGBTQ plus youth. Online spaces can be a sanctuary, a place for acceptance, validation, peer support that they might really struggle to find offline.
That makes a lot of sense. And it's not just about feeling supported. It can actually boost happiness.
Yes, particularly when people use it actively. So direct messaging, having meaningful interactions, sharing things yourself, that tends to link to increased life satisfaction. It's very different from just passively scrolling through feeds.
Active versus passive. That seems key.
It really does. And another major positive, it's a vital way to access mental health resources and information.
How so?
Well, you see campaigns like #mentalhealthawareness destigmatizing issues. People share their stories, find peer support groups online, get pointed towards professional help. It lowers the barriers to getting information and potentially seeking care.
So it's really clear then. The effect isn't simple. It's a tool. And its impact depends massively on your intention, your state of mind, the situation, and how you're actually engaging with it.
Precisely.
Okay, let's unpack this more. What are the core psychological mechanisms driving these effects? How does scrolling turn into actual changes in how we feel?
Right. So researchers have zeroed in on a few key psychological processes. 3 main ones seem to consistently pop up. Social comparison, FOMO, the fear of missing out, and cyberbullying.
Social comparison, we touched on that. It's based on Festinger's theory, right? Humans are wired to compare themselves.
Exactly. It's a fundamental human drive, but social media puts it on steroids. You're constantly fed this stream of other people's lives, often the highly curated, best bits.
Upward social comparison, mostly. Comparing your everyday reality to someone else's highlight reel.
Precisely. And the psychological fallout. Diminished self-esteem, body image issues, especially, as we said, for adolescent girls on visual platforms. It's that compare and despair cycle, which can definitely contribute to anxiety and depression.
And FOMO, fear of missing out. That feels like a very modern anxiety.
It does, doesn't it? It's basically this nagging feeling that other people are having rewarding experiences that you're not part of. Social media, with its 24/7 window into everyone else's activities, just intensifies this massively.
See, the party you weren't invited to, the amazing holiday someone's on?
Exactly. And FOMO isn't just a feeling, it drives behavior. It makes you want to constantly check your phone, your feeds, so you don't miss anything.
Which creates a vicious cycle.
A classic vicious cycle. The more you check to soothe the FOMO, the more stuff you see that triggers it again. And this cycle is linked to higher anxiety, stress, sleep problems, depressive symptoms, and just lower life satisfaction overall.
Okay, and the third one, cyberbullying. That sounds quite different, more direct.
It is. It's intentional, repeated harm using electronic media. And it has some really nasty features that make it different from traditional bullying.
Like what?
Well, the potential for anonymity for the bully, the permanence of the hurtful content, it can stay online forever, and the sheer size of the potential audience, it can feel vast and uncontrollable, which amplifies the humiliation.
That sounds incredibly damaging. How common is it?
Alarmingly common. Studies suggest somewhere between 20% and 40% of teenagers experience it. Some studies find rates even higher, up towards, 57%. And the link to mental health problems here is really strong and unequivocal. We're talking severe depression, anxiety, deep loneliness, shattered self-esteem, even substance use, self-harm, and suicidal thoughts.
And again, certain groups are more at risk.
Yes. Adolescent girls and LGBTQ plus youth are disproportionately targeted. And what's really important to grasp here is how these 3 things, social comparison, FOMO, cyberbullying, they're often interconnected.
How so?
They feed off each other. FOMO might lead you to compare yourself more, which makes you feel bad. Feeling bad might make you more vulnerable to the impacts of cyberbullying if it happens. It can create this powerful downward spiral.
Okay, so these psychological mechanisms are powerful. But what's going on inside our heads, like in the brain itself, when we're endlessly scrolling and interacting?
Right. This brings us to the neurobiology. And the short answer is, these platforms are incredibly well-tuned to tap into our brain's basic wiring, primarily through the reward system. The brain chemical dopamine is key here. Things like likes, comments, shares, new followers, they act as social rewards. They trigger a little release of dopamine, which feels good.
The feel-good chemical.
Exactly. It reinforces the behavior. But it's how these rewards are delivered that's really crucial.
You mentioned the slot machine analogy.
Yes, it operates on what's called a variable ratio reinforcement schedule. It's unpredictable. You post something, you don't know if you'll get 2 likes or 200. This unpredictability is incredibly powerful for forming habits. It keeps you coming back for that potential reward.
Like gambling. You pull the lever, hoping for a win.
Precisely. And the flip side is also true. When you expect a reward, you post something important to you and you don't get the likes you hoped for, that can lead to real disappointment, feeling inadequate.
So it hooks into our basic reward circuits. What about other cognitive effects, like our attention span? Everyone says it's shrinking.
There's definitely evidence pointing that way. The very design, the endless scroll, the constant pings and notifications, it encourages what some call continuous partial attention.
Continuous partial attention.
Yeah, basically your brain is constantly scanning, switching focus, but not really engaging deeply with any one thing. It's like training your brain for distraction.
And that has measurable effects.
Research suggests heavy social media use is associated with poorer performance on tasks requiring sustained focus, shorter attention spans, and more difficulty ignoring distractions.
Is this actually changing the brain? Especially in young people whose brains are still developing.
That's a major area of concern in ongoing research. The prefrontal cortex, responsible for things like impulse control and concentration, is still maturing during adolescence. There is evidence suggesting heavy use might be linked to functional changes there.
Functional changes,
Mm-hmm.
like how it works.
Yes, and maybe even structural changes, though that's still emerging evidence. The Surgeon General's advisory mentioned potential changes in brain regions involved in emotional processing, impulse control, sensitivity to social rewards. It's concerning because adolescence is such a critical period for brain development.
And you mentioned even the physical act of using touchscreens.
Yeah, there's research showing that the repetitive movements can actually reshape the part of the brain that processes touch information from the hands, the somatosensory cortex.
Wow. And memory. Can it affect how we remember things?
Potentially, yes. There's this idea of transactive memory. When we know information is stored externally, like photos on Instagram, our brain might prioritize remembering where to find it rather than encoding the details of the experience itself.
So instead of remembering the sunset, you just remember you have a photo of it on your phone.
Kind of, yeah. And it can shift the focus from actually living the experience to documenting it for performance online, which might subtly diminish the richness of the memory itself.
This is all quite sobering, and it leads to a really important point you made earlier. A lot of these negative effects might not be accidental side effects.
That's a crucial perspective. Many argue these outcomes are predictable consequences of a technology designed, fundamentally, to capture and hold our attention.
Using persuasive technology.
Exactly. It's the application of psychology and behavioral science principles in design to influence user behavior. And the primary goal, driven by the business model, is usually maximizing time on device, because that translates to ad revenue.
So what are some of these persuasive techniques they use?
Well, we've mentioned some. The infinite scroll, there's no natural endpoint. You can just keep going forever.
Right, unlike a book or a magazine.
Exactly. Then there are notifications, those little red dots, the pings, the buzzes. They create a sense of urgency, pull you back in constantly.
Fear of missing out again.
Ties right back into FOMO, yes. Then the variable intermittent rewards the unpredictable likes and comments we talked about, that slot machine effect.
Very addictive.
Highly. Plus, things like gamification, think Snapchat streaks, trying to maintain them. And social reciprocity cues, like seeing that someone is typing a message back to you. It creates a subtle pressure to stay engaged, to respond.
It feels like we're being subtly manipulated almost.
And underlying all this are the algorithms. They curate basically everything you see.
Yeah.
And they're optimized for engagement, not for your well-being.
They learn what keeps you scrolling, right? Even if it's stuff that makes you feel bad.
Precisely. They learn your preferences, maybe even your vulnerabilities. And this has consequences.
Like what?
Well, you can get trapped in reinforcement loops. If you're feeling anxious and click on negative news, the algorithm might show you more of it, leading to doom scrolling.
Oh, I definitely know that feeling.
It's common. Then there are filter bubbles or echo chambers. The algorithm shows you content that confirms your existing beliefs, limiting exposure to different views. This can be especially harmful with things like eating disorder content or thinspiration.
It reinforces unhealthy patterns.
Exactly. And some researchers even talk about algorithmic identity. The idea that the version of the world and even of yourself reflected back to you by the algorithm can start to shape your self-perception. If it's constantly negative, it might reinforce a negative self-concept.
So putting it all together, the negative outcomes aren't just random. They kind of emerge from a system designed for attention capture.
That's a strong argument, yes. And it suggests that just telling individuals to have more willpower is probably not enough. We need to look at the system itself.
Which brings us back to the idea that the impact isn't uniform. It depends on how you use it, who you are.
Absolutely. These are crucial moderating factors. One of the biggest is active versus passive use.
We touched on this. Active is engaging, passive is just lurking.
Basically, yes. Active use is direct interaction, messaging, commenting, posting. Passive use is consuming content without interacting, scrolling through feeds, watching videos.
And the difference in outcome is significant.
Really significant. Passive use is consistently linked much more strongly to the negative stuff. Social comparison, envy, loneliness, depression. Active use is more often associated with the positive outcomes, feeling connected, belonging.
So how you engage matters more than just the time spent, maybe.
It seems to, yes, though time still matters. Another key factor is demographics, especially age and gender.
Adolescence being a key period.
A period of unique vulnerability. Brains are still developing rapidly. Teens are more sensitive to social feedback, less equipped for self-regulation. Research has even pinpointed specific windows of developmental sensitivity.
Windows.
Yeah, around ages 11 to 13 for girls and 14 to 15 for boys. Higher social media use during these specific windows seems to predict lower life satisfaction later on more strongly than at other ages.
Fascinating. And the gender difference. Girls being more affected.
Consistently, yes. Adolescent girls seem disproportionately affected by the negative aspects, particularly around social comparison, body image concerns, cyberbullying, and depression links.
And does the specific platform matter? Is Instagram different from Twitter, for example?
It seems so. Visual platforms like Instagram and TikTok are more strongly linked to body dissatisfaction, which makes intuitive sense.
And that study about using multiple platforms.
Oh, right. The University of Pittsburgh finding. Using 7 to 11 different platforms tripled the risk of depression and anxiety compared to using just 0 to 2.
Even controlling for total time.
Even controlling for total time spent online. It might be the cognitive load of constantly switching between different interfaces, different social norms.
Interesting. And finally, what about individual differences, like personality or pre-existing conditions?
Hugely important. It's often a bidirectional relationship. Someone already struggling with depression or anxiety might turn to social media more, perhaps as a coping mechanism.
But then it makes things worse.
It can, yeah. Especially if they engage passively or encounter negative comparisons or content. This is part of models like the I-PACE model of problematic internet use. Conversely, having strong coping skills or traits like mindfulness can be protective factors.
Okay, so it's incredibly nuanced. But amidst all these risks and complexities, let's not lose sight of the positive side. You mentioned social support, community.
Yes, it's crucial to acknowledge the profound and often vital role social media plays in fostering positive well-being for many.
Like with identity formation for teens.
Absolutely. For adolescents, it's a major stage for exploring who they are, trying out different ways of presenting themselves, getting feedback from peers.
Which is powerful, but also tricky, right? That feedback loop, making self-worth dependent on likes.
It's definitely that double-edged sword again. It can be empowering, but yes, it can also make self-worth feel dangerously fragile, maybe leading to a kind of fragmented sense of self, always chasing validation.
But the social support aspect seems unambiguously positive in many cases.
It really does. Platforms provide emotional support, practical information, connections to wider networks, and a key advantage is the accessibility and immediacy.
Especially for people who might struggle to get support offline.
Exactly. People in remote areas, people with mobility issues, people facing stigma around their identity or condition. Online support can be a lifeline.
And that study you mentioned about Facebook intensity, predicting perceived support.
Yes, striking, isn't it? How intensely someone used Facebook was a stronger predictor of how supported they felt than the number of their close, real-world friends or family. It really highlights the subjective power of these online connections.
And this leads to building specific communities online.
Yes, incredibly important niche and supportive communities. Think LGBTQ plus youth finding safe spaces and acceptance they might not have locally. Or people with chronic illnesses or disabilities connecting with others who truly understand their experience, maybe feeling more able-bodied online.
Mental health communities, too. Reducing stigma.
Definitely. Providing spaces for open, often anonymous discussion, sharing experiences, normalizing struggles, it helps reduce that sense of isolation.
That feeling of being understood, of not being alone, that must be incredibly powerful.
A huge buffer against loneliness and distress for many people.
Okay, so given this whole complex picture, the good, the bad, the ugly, the nuance, what can actually be done? How do we navigate this landscape better?
Well, it's clear that simple answers like just quit social media aren't realistic or even desirable for many. Effective intervention needs a multi-level approach.
Starting at the individual level.
Yes. Therapeutic approaches are showing promise. Things like cognitive behavioral therapy, or CBT, and mindfulness-based interventions. These seem significantly more effective than just telling people to do a digital detox.
How do they help?
They equip people with skills to challenge the negative thought patterns triggered by social media, like social comparison, and to better regulate their emotions and impulses around usage.
What about education, especially for kids?
Absolutely critical. Digital and media literacy education. Teaching users, especially young people, how to critically evaluate the content they see, understand the persuasive design techniques being used on them, and develop healthier engagement habits.
Are there programs for that?
Yes, things like social media test drive. Try to simulate social media scenarios in a safe environment to teach these skills.
And practical tips, things anyone can do.
Definitely. Self-regulation strategies are key. Remember that study showing limiting use to just 30 minutes a day led to significant reductions in depression, anxiety, loneliness, FOMO?
30 minutes, that's quite a reduction for many.
It is, but it shows the potential impact. Other things include consciously curating your feed, unfollowing accounts that make you feel bad, disabling non-essential notifications to reduce those constant pulls on your attention, creating tech-free zones or times, like maybe no phones in the bedroom or during meals.
Those all sound helpful, but you also mentioned systemic issues. Individual strategies alone might not be enough.
That's the argument. Placing the entire burden on the individual user seems unfair when they're up against platforms explicitly designed using sophisticated psychology to keep them hooked. Users are often outmatched.
So we need changes at the platform and policy level.
Exactly. This is where things like the U.S. Surgeon General's 2023 advisory come in. It explicitly called on technology companies to prioritize user health and safety.
What did that involve?
Things like conducting transparent risk assessments for their features, designing platforms with safety first, especially for minors, implementing default higher safety settings for kids, and crucially, sharing their data on health impacts with independent researchers.
And for policymakers.
The advisory called for developing and enforcing legally binding health and safety standards for these platforms. We need actual rules, not just suggestions.
And this ties into the push for ethical design.
Yes. The growing movement demanding things like the Kids Online Safety Act, KOSA, here in the U.S. It's about shifting the paradigm towards well-being by design, making platforms inherently safer and less manipulative, and demanding algorithmic transparency so we actually know how these systems are shaping our experiences.
It's about changing the incentives, really.
That's fundamentally, yes.
So wrapping this all up, it's clear the relationship between social media and our mental well-being is incredibly complex.
It really is. Complex, dynamic, and deeply personal. There's no single good or bad verdict here. It's always this intricate dance between our own psychology, how we choose to use these tools, and the powerful, sometimes manipulative design of the platforms themselves.
We've seen those core negative mechanisms, social comparison, FOMO, cyberbullying, and how persuasive design and engagement-hungry algorithms can amplify them. But we've also seen the flip side. The huge potential for connection, for vital social support, for finding community, for exploring identity, especially when we use it actively and mindfully.
Absolutely. And it's important to remember there are still big gaps in what we know.
Like what?
We need more long-term research to really pin down cause and effect. We need better data than just asking people how much time they think they spend online, more objective tracking. We need more robust studies testing which interventions actually work best, for whom. We desperately need independent researchers to be able to study the algorithm's impacts, and we need more research looking across different cultures. This raises an important question.
So what does all this mean for you listening right now? It means we need to think critically about our own relationship with these tools and collectively push for change. The goal probably isn't eliminating social media. It's too integrated, too useful in many ways. Instead, the challenge is to cultivate a digital environment that consciously tries to maximize those benefits of connection and support while actively minimizing the harms of manipulation and comparison. Can we, maybe, transform this digital mirror? Turn it from something that often distorts and distresses into a tool that genuinely supports connection, community, and growth. That feels like the goal, working towards a more sustainable digital well-being for all of us.
CONCIERCARE, providing world-class, personalized care for patients and members, taking a proactive approach by offering its free digital health clinic for anyone in need of these services. Reach out to us via our website, www.health.conciercare.net, or give us a phone call at 786-809-2345.